Hello, everyone.
Hello.
Well, it's a real pleasure for me to greet all of you. I welcome those who are in live presently, should there be in the morning, the afternoon, maybe in the evening, maybe some of you at night, and also those who will listen to this series afterwards. I'd like also to warmly welcome our guests today, our speakers, especially Prosper, who will be moderating with me. Indeed, this session is very important for FIP because it's FIP's vision that we should have a world where everyone benefits from access to safe, effective, quality and affordable medicines and health technologies as well. FIP mission is to support global health by enabling the advancement of pharmaceutical practice, science and education. And we are pleased to be delivering this event titled Regional Needs and Drivers for Transforming Vaccination, which is focused on the region of Africa. Next slide. Thank you. I will be moderating this session with Prosper, and I would like to introduce Prosper. Prosper Yag, he's the president of the African Pharmaceutical Forum. Prosper is a bit like me. Prosper is speaking French because I am from France and I speak French. And Prosper has a very extensive biography. Prosper, you were qualified in France, in Toulouse. Now you are at the head of the pharmaceutical industry of Africa. You are also an international pharmaceutical consultant, a social entrepreneur, a defender of quality drugs and healthcare access in Africa, a fervent activist for universal health coverage, especially in Africa. You are also a member of the Council of FIP, and you are president of the African Pharmaceutical Forum, president also of the National Order of Pharmacists in Cameroon. Prosper, I don't know how Africa could do without you. You are here because of your significant contribution to actions in large-scale vaccination coverage. So welcome, Prosper. It would be a pleasure to moderate this seminar with you. And I present myself. I am Jacqueline Surug from France. I am a vice president of FIP. I have always been passionate by pharmacy and also by international affairs. I have a long history on international level. I was president of the European Association of Hospital Pharmacies. I have been involved in FIP for many years. I was president of the hospital section of FIP. Now I am vice president. I also chair the Forum for Pharmaceutical Technology. And aside from pharmacy, I have been involved in the technology initiatives, and especially IHE, which is a movement for interoperability. I have been co-chair of IHE and co-chair of IHE Pharmacy, and I was also involved in a e-health stakeholders group on the European Commission. So it's a pleasure to be here with you. And before going on, I have to present another key person for this session, which is our facilitator. This is a charming lady. She is always behind all the things, and she will help us for the questions. She's called Nilan, and she's the lead for education policy and implementation at FIP. So next slide, some housekeeping announcement. If you have looked already on previous series, you know, you are familiar with the slide. This webinar is being recorded and live streamed via Facebook. It will be freely available once over on our website at wawawa.fip.org. You may ask questions during the speakers' presentations, and we encourage you to do so because we will try to answer your questions as long as we can. You please use the Q&A box. You have two boxes below, at the below side of your screen. You have a chat box that you can use to introduce yourself, for instance, and you have a Q&A box, and we will try to answer the questions through this Q&A box. You are also welcome to provide a feedback. You will be required to provide the feedback after the session on webinars.fip.org. And this is important for us to adjust future webinars and try to improve along time. And finally, if you are not yet a member of FIP, please join us. We have put the link for registration here. And it's an important part of what you can do beyond your member organization to join FIP. So next slide. So transforming vaccination regionally and globally is the first FIP information outcome-based online program of its kind, underpinned by the FIP development goals. The FIP development goals, if you are not familiar with these goals, you have a chance to look at them through the website. And please do, there is very important goals. It's, they are really, those goals, an integral part of what FIP is doing, and we are always referring to those goals. Final outcomes of the program is a historical global FIP commitment to action on vaccination and pharmacy, and we will have a FIP transforming vaccination collection since 2021. Next slide. Thank you. So this presentation today is part of a series of webinars. And you see here, we have done 3 series of 8 events each. The first series was on the identification of needs to transform vaccination globally and regionally with the 3 pillars of FIP, which are science, practice, education, and also workforce, which is included with all this. We focused on the strategy, policy for global change. We have addressed barriers and try to figure out how to go forward. On the second series, which was taking place during October and November, during the 3 episodes, we have tried to dissect all the different components according to FIP development goals from the perspective of vaccination. And guess what? In the vaccination program, 17 of those FIP development goals are linked to vaccination. So it is a very important feature that we could connect to all those 17 development goals. And series 3, we are now in this series. We focus on 6 regions of the world, and we try to figure out how they have addressed or how they will address these actions to deliver on the commitment to transform vaccine globally and regionally. And FIP has illustrated this in a short video that we are going to go through now. So if you could pass the video, thank you. So you see in this video, we will focus on the transformation on vaccination on a regional level, where we will identify regional priorities, challenges, and learning with our members and stakeholders. And this video, this series, will also culminate in a global FIP commitment to transform the vaccination built on practice, science, workforce, and education, as I already mentioned. So before going further, I would like to encourage you to engage with us and answer those questions which are on the screen now in the chat box. While you are listening to the speakers, try to think about those questions and answer as you can. The first question is, what single factor should be prioritized to transform pharmacy vaccination services globally and regionally? The second question is, what would be the most important achievement in terms of pharmacy vaccination services in your country in the next 5 years? And the last question and third question, what else should the FIP commitment to action outline? So think of this question while listening to the speaker and think of what it is like in your own country, and whatever you will put in the chat box, in the Q&A box or chat box, will help us. So it's really a great service that I ask you now. Thank you very much. At the end of the session, Nilan will introduce another little small questions also to engage you with us. So with this, I will turn to Prosper to introduce this session on Africa, just mentioning that the learning objectives is to understand the African perspective. In today's episodes, the fifth of the 6 regions, we dissect the regional needs and drivers for transforming vaccination in the African region should be discussed and displayed. Okay, over to you, Prosper.
Thank you, Jacqueline. Slides. No. Come back, please. Jacqueline has given the learning objectives. I think what we are doing today is to understand where we are in Africa, where we are in terms of vaccination in each of our countries in Africa, and how to transform vaccination globally and regionally. Globally means all over the world. Regionally, in our region, what are we going to do to transform vaccination? The main outcome of this event is to understand where are the gaps to fill, where are the barriers, what we have to do to support our countries, and to go forward for more immunization. That is why I would like to say this on behalf of African Pharmacists of Africa, that this event is a big event for us and for all the pharmacists of Africa should be involved in this process of vaccination people. But we will see that there are many gaps, many things that we have to tackle. And all of this, I think with our speakers who are very competent, we will see how to tackle our difficulties. Thank you. The next slide. Okay. These are our speakers. I will first introduce Yvonne. Yvonne Yirankiwa is from Ghana, a Ghanaian lady. I don't see my screen. Mm.
So, Prosper, do you need help with the slides?
With the slide of
Claire, do you want me to introduce Yvonne?
Yes, but I have a problem with my slides. Which me, Yvonne.
So the text should be in the notes part, but we can see the slides on the screen. We can hear you as well. Perhaps while you are trying to resolve the slides issue, Jacqueline may introduce.
Are you okay with this, Prosper?
Yes, yes.
So Yvonne, it's a pleasure to introduce you. Yvonne, you are a pharmacist and a pharmacologist. You're also a lawyer, a management consultant, and an educator. All this on one hat. Wow. Yvonne, you have experience in leadership, in governance, in policy, in human resources management. You're also a lecturer of pharmacology, toxicology, medical law, and ethics, and of course, leadership. So you are a very skillful lady. You are president of the Pharmaceutical Society of Ghana. You led the drive to include pharmacists in vaccination services in Ghana and extend pharmaceutical services to improve public health. You are also the chair of the disciplinary committee of this society. And on top of that, you are rector of the Ghana College of Pharmacists. You are a fellow of the Ghana College of Pharmacists, fellow of the National Safety Council, Ghana, member of the International Society of Pharmacovigilance, a counselor of the Commonwealth Pharmacists Associations, and editor-in-chief of the Ghana Safety and Health Journal. And you are the chairperson of the Lady Pharmacists Association of Ghana. Well, I will stop here because you have so many things on your personality. So I guess now, I don't know, Prosper, if you want to add something to this charming lady, I think we can hear to her now. We can listen to her. Okay, please, Yvonne, go on.
Okay, so thank you very much, Jacqueline. But just one small correction. I'm Vice President of Pharmaceutical Society of Ghana, not the President, and I used to be the chairperson of the Lady Pharmacists Association of Ghana, but not anymore. So to look at vaccination by pharmacists in Ghana, we want to just look at a few aspects so that we can be quick. Looking at regulation and access in Ghana, of course, I suppose that as in every part of the world, the policy part of it is led by the Ministry of Health, and the Public Health Act, our Public Health Act is actually the piece of legislation that governs vaccination by all healthcare professionals, and when pharmacists are involved, in pharmacists as well. Now, when there are vaccination programs or there is a need for vaccination, it will be implemented by the expanded program for immunization, which ensures that a policy on antenatal, postnatal immunizations and routine immunizations are taken care of. And also they go through or roll out campaigns to ensure that no child is left behind. We also have public and private health facilities that will normally be involved in routine, as in the antenatal, postnatal, as well as emergency vaccinations if somebody is exposed in some way and needs some vaccination, as well as travel vaccination. The next slide, please. Now, in Ghana, Pharmaceutical Society of Ghana recognizes the need for pharmacists to be more involved in vaccination. And in that regard, we participated, and I was the one who was part of the FIP Advocacy Summit on Pharmacist Immunization Rights, which brought together people from all over the world, pharmacists from countries where pharmacists are involved in immunization, and pharmacists from countries like Ghana, where we are not really that much involved in it. So that's what we have done. We've also had held discussions with our regulatory stakeholders, our Ministry of Health, so that they appreciate the role, the contribution that pharmacists can bring on board, and also the expanded program of immunization. And I must add that the Deputy Director is a pharmacist, so our discussions with him have been very good, and indeed with the whole program have been very good. Also, we've had discussions with the Pharmacy Council because they regulate the practice of pharmacy in Ghana. And we want to ensure that we don't get to a point where it becomes like, because we don't traditionally, pharmacists do not participate in immunization, then pharmacists cannot do that, participate moving forward. So we have engaged the Pharmacy Council as well. But we have also seen that it's important to get pharmacists engaged. And in that regard, we have had two major meetings in the two biggest regions in Ghana, Greater Accra region and Ashanti region. And in those meetings, what we did was to explain the legislative background, what pharmacists can bring on board, the various ways in which we can contribute, and also how we plan as a society to move that agenda forward. We also had our annual general meeting, and we have our annual general meetings every year, but 2 years ago, our focus was on what we can do as pharmacists with respect to the participating in vaccination and immunization. Then last year, Pharmaceutical Society of Ghana, the executives led by our president, led a tour across the whole country. And we went from region to region, meeting and discussing with pharmacists issues that concern them. And high on the agenda was the vaccination by pharmacists in Ghana. In order to ensure that we get buy-in and we do not have the problem where it's like, oh, you were not really trained in that area. We thought it would be very important for us to get a comprehensive curriculum developed, which, and on that regard, we contacted the Department of Pharmaceutics of the Kwame Nkrumah University of Science and Technology, and they developed a comprehensive curriculum. So we currently have our comprehensive curriculum for the training and retraining of pharmacists in participating actively in vaccination. The next slide, please. Can I have the next slide? Thank you. Now, in going through these, we have come across quite some interesting barriers and restrictions. One, we have put them into two categories. One being the professional. In Ghana, not traditionally, vaccination has been seen as within the purview of health professionals other than pharmacists. And so once we started talking about the possibility of pharmacists getting involved, we got some pushback in that some healthcare professionals perceived that pharmacists would be taking over some kind of role. But this we have tried to counter just to show to them the role that pharmacists will play, because in our engagement with the EPI, we realized that most of the children who are left behind when it comes to vaccination are children in urban areas rather than rural areas. Indeed, all children in rural areas get covered with all their doses, but not in urban areas. And since the majority of community pharmacies in Ghana are located in urban areas, we believe that that will be a way of getting, ensuring that no child is left behind. And this has helped in improving buy-in among some of these people who were giving us some pushback. But we also found that pharmacists are also themselves quite a bit reluctant, because, I mean, the thing is, acquiring new skills, pharmacists are already doing so much in the community, in the hospital, in the production sector, in various areas, in advocacy. So acquiring new skills or reviving old skills that will enable them to participate in vaccination, and even the added responsibility of being so directly involved in these services, as well as the fear that if there is one ADR that occurred in a community pharmacy, for instance, it would bring a lot of backlash to the practice of pharmacy in Ghana. So these are some of the issues that we have identified, and we are trying to address them and get them to understand that all the training will ensure that at least ADRs will be lower, if possible, than what would happen in any other facility that we're providing these services. And also to let pharmacists know that it doesn't have to be every single pharmacist who is participating. It will be only those who feel competent, who feel comfortable in taking on these additional responsibilities. Again, because practices in Ghana do not participate in vaccination services, what has happened is that there has been an unspoken misunderstanding of the law that pharmacists cannot legally in Ghana administer or be part of the vaccination or immunization service delivery. And so we have used the law in part of our, as part of our engagement to explain to pharmacists what the law actually says, and the fact that the law does not bar pharmacists from providing these services. The next slide, please. Now, in addition to these professional issues, we also realized that there are some financial difficulties. Indeed, because we envisaged that it would be good, it would be beneficial if we had a critical mass of pharmacists who have obtained the requisite training, the requisite comprehensive training, who are comfortable with participating actively in immunization and vaccination services. But we realize that because vaccination is not a part of the traditional role of the pharmacist in Ghana, there isn't a budgetary allocation by pharmacists or their employers to train pharmacists in that area. And because of that, we are trying to see if it is possible for us to get some financial support so that we can, because it is a comprehensive training, we are expecting that the pharmacists will have to take off time for a certain period of time of their work for a certain period of time, which could lead to loss of income if it is not something that is supported by their employer. And so we are looking at ways around discussing how we can have support for these pharmacists who may be interested. And we're also speaking to pharmacists to let them understand that this would be a good, if they were interested in participating in immunization and vaccination services, then this would be money well spent if they would put money to that. And so these are some of the barriers that we have come across, but which we are working to ensure that everything works out well. Can I have the next slide, please? So moving forward, we are working towards, as I mentioned earlier, we have had discussions with the Pharmacy Council, and so we are looking towards getting accreditation for the comprehensive training by Pharmacy Council. Indeed, one of the in Ghana is that pharmacists are required to have certain number of credits in a year in order to renew to practice the following year. And so if we get accreditation for this, it will also increase interest in the program, because then pharmacists who are able and willing will find, in addition to acquiring this, it also reduces the credit points that they will need. And so once they have gone through it, they will need fewer credit points in the year to renew their licenses. And so to sending out a call out and then going through a screening process in the quarter of 2021. Now we want to screen because we want to make sure that pharmacists who enroll on the program are those who are able to immediately participate in, for instance, COVID-19 vaccination if it appears in Ghana, if it happens in Ghana. And because of that, we want to make sure that they have the facilities, they have the resources to ensure all the requirements to roll out vaccination process. So the first training, we are looking at the second quarter of 2021, and we want to use any learnings from that training to do another training in the fourth quarter. So we want to have lessons learned and use it to modify, if necessary, program B, whether it is a structure, whether it is the training time and all of that in the second quarter. Now, this training will be done by the Ghana College of Pharmacists, which is the institution in Ghana that has been legislated in Ghana. We also do have the West African Postgraduate College of Pharmacists. The Ghana College of Pharmacists is established by law in Ghana to train pharmacists at the graduate level. So we are hoping to do this in collaboration with the KNUST, so that when it is rolled over, it is also recognized as a training. Because the career has been developed in KNU, we are in discussions with them to ensure that it will be incorporated into the curriculum as a module, an optional module for pharmacists in training who want to participate in vaccination and immunization. We are hoping that this will position us for being part of the COVID-19 vaccination if and when it arrives in Ghana. And also we believe that if we have been successful in that, then we should be able to extend to childhood vaccines, which are the routine vaccines that are administered regularly, and extend further to all available vaccines which are utilized in Ghana. And so these are what are the things that are happening in Ghana, the Pharmaceutical Society of Ghana, the steps that we have taken, and how we see ourselves going forward in ensuring that vaccination by pharmacists becomes a real in Ghana. I thank you.
Any question? Thank you, Yvonne. Thank you very much. I think we have learned a lot from your country. We have to learn more to maybe to follow you. I forgot that you were a lawyer.
Yes.
Okay.
Thank you.
Thank you. Jacqueline.
Prosper, we have a couple of questions in the Q&A box, so I can share this with you and Yuan.
Yeah.
So actually, the questions more or less have been answered, but one of our colleagues, Gupta, has asked two questions. If pharmacists in Ghana are engaged in vaccination of all immunization programs, but at the end of the presentation, we discussed that the immunization and vaccination will be expanded, but perhaps there are more points to mention on that. And the answer was, would community pharmacists allowed to give vaccination? So these 2 points were covered, but if there are more things to elaborate, that would be an opportunity. And we also received a couple of questions if the priorities for countries that will introduce vaccination should focus on regulations, as you won't have rightfully presented. And also there was a point from Nigeria, one of our colleagues, that the curriculum engagement was done at undergraduate pharmacy training level. So the pharmacists were competent upon graduation. So that's also similar case in Ghana as well. And also, again, we have another comment about engaging with Minister of Health regionally and globally for FIP to support introduction of vaccination. So some of the comments, some questions were covered, but I'll happy to share this with you in case if there are more points to mention around that.
Okay, thank you, Nilan. Yvonne, can you add something?
Yes, okay, so just something to add. So I believe one of the questions was whether pharmacists currently participate in vaccination. No, not in Ghana, not yet, but that's what we are working towards. Mm-hmm. And the aim is not to, the aim is to make it optional, of course. And yes, on making it, ensuring that it's part of the curriculum, that's something that we are doing. And the only reason why it hasn't happened was that by the time this curriculum had been revised, developed, the university had gone through their reaccreditation for the program. There's a periodic reaccreditation for training programs in the universities in Ghana. And so they had already gone through, they had finished not up to 6 months. So they assured us that at the next reaccreditation, when they are going through that process, they will incorporate it into that. And yes, with respect to the regulation, we agree. In Ghana, we do not have the problem that the law stops us. It is just the practice. The practice is that pharmacists have not been involved, and so we want to engage pharmacists to remove that concern that maybe if they were involved in vaccination, they would somehow be breaking the law. And indeed, because of that, in order to ensure that a senior medical officer accredits any person as a public vaccinator, we have added senior medical officers as part of our of our faculty for the training, so that when it is finished, they will go ahead and do the accreditation. And that is what the law requires. So once that is done, then the pharmacists will be able to participate. Okay.
Thank you.
I think there's a question on what challenges. I believe I mentioned some of the challenges that we have experienced. We are not actually practicing yet, but we want to ensure that by the time we are practicing, almost every ground is covered, so that the issues that we have to deal with are not left hanging. Okay, so the question is, can the training for pharmacists not hold earlier in the year? Yes, the first training will take place in the second quarter. We are not even sure when we will have any, when we'll get vaccines in Ghana, but we hope that if there is the need for us to have the training earlier, because maybe immediately after January, we find that we have sufficient numbers. Why not? Because the curriculum is ready, the faculty is ready, and the premises are ready. So we don't really have a problem with moving it earlier. I think that can be done. Thank you very much.
Thank you so much, Yvonne. After Ghana, we are now going to listen our colleague from the north of the continent, from Algeria. To speak about the situation of Algeria, it's our friend, Redouane Swalni, who is pharmacy graduate from Algiers University, is devoted to his profession since early years as a student. He was the founder of the Algerian Pharmaceutical Association, Student Pharmaceutical Association. He was also the chairperson of the African Regional Office in International Pharmaceutical Federation, IPSF, co-founder and Secretary General of the Algerian Pharmaceutical Federation. Redouane contributed also in the creation of Untitled Chapter, Algeria, of International Society of Pharmacoeconomics and Outcome Research. Dr. Selouani pursued his post-graduation in France at Paris Descartes University and United Kingdom and York University. He has a Master of Health Economist from UPF in Barcelona. During his career, he contributed to the development of pharmaceutical practice and science in his country, Algeria, but also in the international level. He supported his country with local association to join IPSF in 2010 when he was a student. He continued supporting his country in order to raise the voice of Algerian pharmacists at the international level, and FAP become the first Algerian pharmaceutical organization to join International Pharmaceutical Federation, FAP, for the first time in 2015. Redouane is practicing pharmaceutical industry where he is committed to bring medication to patients. He is responsible for access to reimbursement. He did many researches about health technology assessment, economics evaluation, atrial fibrillation, diabetes, and idiopathic pulmonary fibrosis. Redouane.
Thank you, Prosper. Thank you for the introduction, and good afternoon, everyone. First of all, thank you to FIP team for the invitation and giving us the opportunity for our region and also for Algeria to give an overview about the role of pharmacists in vaccination. And as it was presented by Jacqueline in the introduction, I think transforming vaccination is something very crucial and important for pharmacists in order to contribute for large vaccination for the population, and here the pharmacy can play a strong role. I think the first presentation from Ghana is really interesting what is going on in Africa. There is some countries already started advocating in order to put in place the pharmacist as a key player in vaccination. For Algeria, I think we have a lot of work to do in order to make pharmacists as a key pillar on vaccination. And I wanted to start my presentation just giving an overview about the regulation and access to vaccination in general. So vaccination is really a key program and a key priority for from the of the government and the Ministry of Health. In 2015, the Ministry of Health published a report regarding the extended program of vaccination, where vaccination is one of the pillar, as I said, of the public health, and in order to extend the vaccination for the whole population and raise the rate of vaccination also. So vaccination in Algeria is regulated by Pasteur Institute, those are responsible for the approval and also the distribution of the vaccination through the public institution who are participating on the vaccination program. Vaccine is provided for free. It's supported by the government for all the population in the country. Next, please. So the integration of vaccination into primary healthcare, that was one of the a pillar of the program, the extended program established by the Ministry of Health in 2015. And here we can see that there is more than 7,000 local healthcare structure are participating on the follow-up of the vaccine, and almost 240 healthcare providers, and it's mainly public hospitals, are participating in the vaccine for the children's. And as you can see, like now, one of the pillars, as I said, that the Ministry of Health put in place is the contribution, is the integration of vaccination and primary care. But we can see, unfortunately, that the pharmacists are not on this program. And here, the transition where we can say that the today, according to regulation and even for the practice that for the primary care vaccination program, that the pharmacists are not involved on those program, but only the public hospitals or public institutions are working as a providers on the vaccination. Next, please. So the role of pharmacists, what we are doing in the community pharmacy in Algeria, the vaccination is not authorized for pharmacists according to regulation. But what the community pharmacists are doing, they are contributing on the for the dispensation of the vaccine, providing the flu vaccine. So that's only where pharmacists are contributing, but there is no regulation with covering that. But at least there is a contribution from our part as a pharmacist on that. In terms of, I think, barriers and issues, we see it as the Algerian Pharmaceutical Federation as not something volunteer coming from Ministry of Health who are against, or the government who are against that, but I think is more than lack of awareness from our part as a pharmacist. We never put that on the table, and we never discussed about the role of pharmacists, how they can contribute. And also we didn't participate, also for example, the program, the guideline published by the Ministry of Health in 2015, and the pharmacists, they didn't participate and contribute on this program. I think otherwise that things could change like 5 years ago. There is also absence of the lack of the regulation in terms of healthcare providers who, from the healthcare professionals, can provide or do the vaccination. It's not mentioned in the regulation, and then this is for us. It's an opportunity that we can open, and it's already. We talk about the next steps and the follow-up and the next steps in the coming slides. What we are doing and what we do in the next steps. So as we see it in terms of, of course, there is a barriers, there is some issues that I said already, but on the other hand, I think there is really an opportunity in order to contribute as a pharmacist on the vaccination. Next, please. So our plan for the plans and inspiration for the future of the pharmacists vaccinating. This is what we are doing at the FAP, the Algerian Pharmaceutical Federation, with our plan that we put it in place, which is called Plan of 1924. We call it Vaccine Pharmacist in Action. And as you know, the FIP development goals, one of the pillars is vaccination, and Algeria, as a member organization for FIP, are working with the FIP in order to develop the development goals, and one of them is vaccination. So what we did already is we are working on that internally, and our main objective is to integrate pharmacists in vaccination in order to increase vaccination coverage in Algeria, and also increase the accessibility, the access to the vaccine within the community, and in order to optimize the immunization rate in the country. So all of that with the vision that the FIP is developing, and also the other countries that are putting in place, where pharmacists can help and contribute in the vaccination in order to improve the public health. So what we are doing is we created already a task force on the within the Algerian Pharmaceutical Federation with the community pharmacists, decision makers, scientists, and we did already a survey in order to see what are the gaps that are in terms of vaccination program, and also what we need exactly as a pharmacist in order to put in place this program. And in order to present the role of pharmacists in terms of regulation, because we would like that when we present the project to the government, it will be something that covering all the decisions, and also to have the doing the vaccination on the, let's say, on the right way, to have the right skills. And also, as I said, in this task force, we included the scientists and also the university, because we need to update put in place special programs, and also update the graduation program and post-graduation program, where we need to include vaccination program education on the university. Next, please. So yeah, I think I talked already about this point. We created already this task force, and our priority is mainly the partnership. We would like to build the trust and bridge between us and the government, and also the different stakeholders. So we'd like to really bring the added value that pharmacists can bring on this and vaccination. And here also I would like to strengthen on some point, because we'd like to put in place this program as soon as possible. And with the expertise of all our network, mainly in FIP experts, I think we could implement this project as soon as possible and quickly. Next. So from this is, I think, from the Algerian perspective, but from the regional needs and priorities, I think we can do work together as African forum and African region. Our countries are very sensitive of the guidelines and the recommendation coming from WHO, and we can, if we have a statement coming, let's say, from the WHO, and we know that the FIP is partnering with WHO on that, directed to the government, that will be very useful and make our work very easy when we bring that on the table with our proposal project. And also on the other hand, we need, I think, a collaboration within the countries member maybe of FIP in Africa, as we have the same challenges, we have the same, let's say, issues and the same, let's say, similar resources. And this would be very helpful if we can put in place cross-functional work together to have a better synergy and also collaborate with the WHO, Afro in our region. And I think if we succeed to have this synergy between us as a countries, we have the example now of Ghana, where they are doing something very interesting and great jobs. I think Kenya, our colleague, will present maybe they are definitely doing something interesting, and other countries, Cameroon, South Africa. So if we put all our energy together in order also to try to put a strategy for the region and also learn from each other in terms of experiences and priorities, I think this will be, and also I think vaccination, having a WHO is really crucial and critical, as our government are very sensitive to that. I think within that, having a contribution for pharmacists in vaccination in our country and also in our region. So I think I'm done. This is my contribution for that. So if you have any question, I'll be happy to answer for that.
So thank you very much, Redouane, for this very thoughtful presentation. And thank you also to have mentioned WHO, because I think WHO is a key partner in the landscape, together with FIP and of course the member organizations. So I'm turning just now for burning questions from Nilan.
Mm-hmm. Thanks, Redouane, for great presentation. Thank you, Jacqueline. We have a question from our colleague Mohammed Kesheba. Sorry for the mispronunciation. The question is about pharmacy law in Algeria and how easy and speedy its amendments to introduce new practice regulations. So that was the question about pharmacy law and its flexibility.
I think, in terms of in our region, in terms of law and changes, it's not something easy to do. But the opportunity that we have, if I talk about my country, Algeria, today, that we have a ministry created like less than 1 year dedicated to pharmaceutical industry. And it's and on the top of the ministry there is a pharmacist who is very sensitive and who is really he was advocate of pharmacy, and things are really changing. If I give an example of pharmaceutical industry, they are changing fastly the rules and the amendment of the law. So if tomorrow we bring something, and this is, I think I would like to strengthen on that, this our contribution as scientific or professional organization, if we bring something strong in terms of project, in terms of amendment of the law, and something with the evidence that this will be something contributing, for example, to for a public health, I think this can be done not quickly, but at least we can do it. It will not be taken a lot of time. It will not be hard. It will not be easy, but we can do it.
Thank you.
Thank you very much. Yeah.
Question. Sorry to interrupt. We have another question. Why are, from our colleague, trying to see the name. It was in the chat box. Sorry, I couldn't notice that. But the question is about why vaccines in Algeria are not registered as medicine, from Miriam Amia. Yes.
That's a really good question. Thank you for this question. So as I mentioned in my presentation in the beginning, that the vaccine is regulated by Pasteur Institute, and the Algerian pharmaceutical, let's say the Algerian FDA, is not regulating the vaccine. And I think this is something very important and interesting, that we are tackling in our task force. In terms of regulation, we need to work on that, because the vaccine is not considered as a drug, as a medicine. And in terms of regulation, like Pasteur Institute are doing everything. He's doing the commercial thing, the commercial part, and he's also responsible for the approval. And you cannot be the policy and the judge at the main time. So here, in terms of let's say evaluation and assessment, so did also the Pasteur Institute having the let's say the competency and the skills in order to assess and the drugs in terms of quality, in terms maybe efficacy they do, but in terms of quality, do they have I mean, all the equipment and all the necessary things in order to approve it? This is a big question. But what I can do from the Algerian Pharmaceutical Federation perspective, this is that really we are discussing that, and we would like also to present our recommendation in order to consider vaccine as a medicine, and it should be approved and assessed by the Algerian FDA.
But you know, Redouane, Institut Pasteur is from a French origin institute, as you know.
Yeah.
And all the drugs that he issues, including the vaccines, they are drugs in France. They are considered in drugs in France. And I use a lot in my hospital, and they are all licensed drugs. So there is something here which is a bit very peculiar, so that you cannot recognize. Yeah. Sorry, maybe.
Yeah, sorry. Yes, I think we follow the same model as France, but in terms of vaccination in France, is it approved by NSM or is it assessed by the Pasteur Institute?
No, it's NSM and EMA, the European Medicine Agency.
Yeah. Which is not the case of Algeria.
So I think there is a law issue under this, so it should be resolved. It should be maybe a temporary misunderstanding, but it should be. We should be able to resolve that.
Yeah.
I wanted to comment something. Algeria is the first country in Africa where there is a ministry dedicated to pharmaceutical industry. This is something very important to highlight. And the minister, was the former president of the council, Lotfi Ben Mohamed, who is somebody who is very committed, very engaged. And Algeria is also a member of WHO Africa, which is not the case of Morocco or Tunisia. It means that we have an important member in our region who can advocate, who has a strong position in Africa that we can use to push our government, to push policymakers to make pharmacy involved in vaccination. Something that I wanted to add.
Thank you very much, Prosper. I think, we have a great opportunity to have this ministry dedicated, and also I think he's really dedicated to help us in different projects. And one of the discussions that we'll have also with him is regarding vaccination, and hopefully, as you said, that he can influence the government to help us to change and contribute as a pharmacist. And why not to have this synergy also with other countries in Africa?
Okay, thank you. I will give the floor back. I will hand over to Jacqueline to introduce our next speaker.
Yes, thank you. Thank you, Prosper. Thank you, Redouane. And it's my pleasure now to introduce our next speaker, Nahil Dave. Nahil Dave, Superintendent Pharmacist in the Pharmaceutical Society of Kenya. So if I look at your biography, Nahil, you have been qualified from the University of Nairobi, and you have also a certificate of vaccinology, which explains your presence here. You have been working as a practicing community pharmacy at Axita Pharmacy Limited in Naivasha. I'm not sure about the pronunciation of this city, which is in Kenya, of course. You have worked as a CEO and Manager Director of Armicon Pharmaceuticals Limited in Nairobi during 3 years, and you have worked also as a Marketing Director of Modern Dental Supplies Limited in Nairobi from 4 years. It was in 2012. And you have worked also for Weston's Chemists Nairobi as a pharmacist before. And you worked also for the Ministry of Health as a pharmacist intern as the new Nyanza General Hospital in Kisumu. That was in 1995. You have other activities. You are a member of the Board of Governors of Guru Nanak Hospital in Nairobi. You were also member of Board of Governors of Total Health Clinic and Pharmacy in Naivasha, and member of the Nakuru Health Task Force from August 27th to October 27th, which was a short mission. Okay, so you have many qualifications, Nahil. So we listen to you.
Thank you very much. Yeah, that's my first slide right there. Thank you. So there are some points that highlight the situation regarding the administration of vaccines by pharmacists in Kenya. So there are 3 aspects that I found which are quite important to highlight as far as our situation in Kenya is concerned. That is regulations and laws, gaps in training and infrastructural challenges in our country, and then I thought of the way forward. So maybe I can have the next slide. Okay, so our regulations is Cap 244 laws of Kenya, that is the Pharmacy and Poisons Act. And our act actually states that pharmacists are supposed to have the following functions, that is procurement, stocking, dispensing, and administering medications, as well as prescribing to a certain level. So the administering of medications in the cap in the act does not bar you from administering any medication. So as a result of that, the law actually does allow pharmacists to administer injections. And since vaccines, unlike in Algeria, are captured as medications and registered as such, then we are allowed to administer them. But there was a little bit that I saw from Ghana, where there was a little bit of an aspect of a little bit of a clash in terms of levels of practice happening there. And in our country, Kenyans are very competitive. So every healthcare provider wants the provision of services to be part of their turf. And as far as practice of pharmacy in Kenya is concerned, we have a diploma course in pharmacy, in pharmaceutical technology. And over the years, most of the dispensing pharmacies and community pharmacy practices are run by pharmaceutical technologists without the presence of a pharmacist. And in fact, you do not need to have a pharmacist in a dispensing pharmacy in Kenya. So as a result of this, if we try to roll out vaccinations as part of the services provided at a pharmacy, then we need very urgently to start differentiating levels of practice in the community pharmacy setting to actually capture drugstores, dispensing chemists and pharmacies, and then community pharmacy practices where there are actually pharmacists on board who can actually take over this and actually provide this service of vaccination. I have been practicing community pharmacy in Kenya now for about 8 years in Naivasha, and I've been providing vaccination services because in our government vaccination program, which covers everybody, there are gaps in the vaccination because of costs. So we have middle class, upper middle class, and upper class citizens who would wish their children and themselves to be covered with the full spectrum of vaccines. So that is usually the preserve of the private sector, which of course as a government does not offer those. And so I've been giving those services ever since then, because you are allowed as a pharmacist to administer medication. So I was using that law to do this. And then came the time when University of Nairobi, the School of Pharmacy, under Professor Wantai, said that they wanted to start creating a curriculum to empower pharmacists to actually be formally trained to be able to give vaccines, and as such recognized as the vaccination centers as well. So at that point, there was a tie-up, a collaboration between American University and University of Nairobi. And at that point in time, the Pharmacy and Poisons Board, which actually regulates the practice of pharmacy as per the Act in Kenya, actually started encouraging community pharmacists to incorporate a consultation room where they can give consultation services, and including some clinical services like administering of injections and stuff like this. So that was that is the situation as it stands as far as the laws are concerned in our country. So next slide, please. Okay, so as I was saying, there is this program which needs to address gaps in training. So there is a formal need for training in intramuscular and subcutaneous injection techniques in Kenya. The reason is, I personally in my county, we are in a county called Nakuru County, and in my county I actually gave 2 training sessions to the pharmacists all over our county, whoever wished to attend, in intramuscular and subcutaneous injection technique. And in those training sessions, we discovered that the pharmacists are extremely shy, and in some cases actually afraid of actually practicing clinically. So we as pharmacists need to get away from our behind the counter approach and start actually working with patients and giving the clinical services that we can actually give. And the other thing I found that makes pharmacists hesitate from actually providing such services because of fear of encountering adverse effects, anaphylaxis and stuff like this. So we need to incorporate a formal training in CPR, emergency medicine, and first aid, especially in situations where you are in your clinical pharmacy practice and you are administering vaccines, and what happens if somebody gets an anaphylactic shock. So this is the reason why pharmacists have been shying away, because of fear, because of feeling inadequate, and lack of proper internship training and clinical training when you go for your internship at the hospitals. So although the new curriculum, I think, is now starting to incorporate formal training for emergency medicine and CPR at the University of Nairobi, and also administration of injections and vaccinology is actually becoming part of the curriculum, there was a great need to actually bridge this gap. And therefore, Kansas University came in and they did the Kansas to Kenya program, which I'll talk about in the next slide. So the other problem we face, before I address this slide, the other problem we face in Kenya is cold chain. We have very poor cold chain. So I'm in Naivasha. So if I want vaccines to be brought in to me from 100 kilometers away, the capital city is Nairobi, I actually have to arrange for my own cooler boxes to be sent to the vaccine distributor so that I can actually preserve my cold chain myself. If you do not care about it, there is no real regulation preventing you from transporting vaccines even through a courier service which does not have a refrigerated van. So what happens is ice-packed vaccines are sent through a courier service like Wells Fargo, and you will probably get the vaccine the following day. That actually makes our ability to roll out vaccination services throughout the country in community pharmacy practices very difficult. And so something needs to be done to form up our cold chain regulations and to form up cold chain logistics in this country. All right, so the way forward, the Kansas to Kenya training program is very important. I participated, I think, in this. There have been 3 programs, so 3 training years in this program. I think I participated in the second one, and we are actually strengthening that program as well to try and incorporate CPR and other aspects, so that we can train pharmacists who have not gotten the formal training in university to actually get covered through this program. So it's really worked very well for us. And the Ministry of Health and Pharmacy and Poisons Board are actually supporting the training of pharmacists in injection techniques and in vaccination administration. And in all these Kansas to Kenya training programs so far, the Pharmacy and Poisons Board have been involved, they have actually encouraged, and the Ministry of Health is actually looking forward to having pharmacists come on board as vaccinators in this country. So there is hesitation because there is no formal licensing being provided at the moment from the Ministry of Health, and there are talks going on about actually evaluating individual community pharmacy facilities and then licensing based on the equipment and the ability to have the correct infrastructure to be able to safely give and deliver vaccines. So we need an individual initiative. Like from myself, if I did not have the initiative to provide these services, then Nevasha would not have vaccination services in the private sector here. So as I do it, that is why we have the vaccination services. And so there is a great need for advocacy to actually amend the laws to allow pharmacists who are practicing community pharmacy in Kenya to actually get those approvals from Ministry of Health as a routine licensing regulation. And PSK, the Pharmaceutical Society of Kenya, is actually a very, very strong lobby group, and they do a lot of advocacy to try and get the lawmakers to actually amend laws to allow pharmacists to formally vaccinate. So those of us, we have a lot of community pharmacists in Kenya who are already vaccinating, and we are vaccinating using the ambiguity in our law, but we need to formalize this now. Thank you.
Thank you, Nail. Nilan?
Yes. Thank you, Nahil. We have a question since Rudwan was speaking, but I think because Nahil also mentioned about the need for education across pharmacists, maybe we can also take that question. We also just received another question as well. So the question was from our colleague Nathan Finkelstein, where he asked about harmonization across the continent on pharmacy education in order to introduce vaccination. Would there be an opportunity for regional organizations, national organizations to get together in an union? Maybe the African Pharmaceutical Forum could be an opportunity for that. That was the question. And the other question is about the perception of patients towards community pharmacies delivering vaccinations or administrating vaccinations. So these were 2 questions we received in the chat box for now.
I can address the second question, and that is the perception of patients who patronize pharmacies. I can do this because I personally am involved in doing this on a day-to-day basis. And I find that especially when Kenya was trying to roll out the vaccines for cervical cancer, my patients were more likely to listen to me and come in for those vaccines than when they would visit their pediatrician or when they would visit their gynecologist and be recommended the vaccines in a different clinical setting. So the perception, I believe that in our country, pharmacists are very, very much trusted by patients who come in to seek services.
There was a question maybe for the president of APF. We were talking about harmonization of education. I think we are on that way with the expansion of unitwin UNESCO program to all the continents. This program has succeeded in 10 countries in the East Africa and East and some countries of West Africa. But we want to expand it to all over the continent. With that, I think we will have the harmonization of the education of our pharmacists everywhere in our region. I think it is important because in many countries, and the countries that are here today, you will see that there is a lack of education of pharmacists on that subject. We have to change it to educate more, bringing pharmacists to services, but that services will not be free. That is another debate that we will have maybe not today, but at the next time. Thank you.
Thank you, Prosper. That's a really important point. We will focus as FIP and African Pharmaceutical Forum, and we'll be working with our colleagues across the African continent. First, to see the needs and priorities in pharmacy education, we have seen the vaccination is one of them. And then we'll see what kind of transformations we can facilitate, and also this program is being one of them.
Thank you, Nilan. Before going further, I would like to ask a question to Nahil. I would like to know, whenever you vaccine for community pharmacy, make vaccinations, is there a fee?
Yes, of course. I do charge a fee for.
And do we have an idea of how much it is? It's difficult to know, but at least give the fee in your country, and we will try to translate it in euros or US dollar, just to know about how much the fee is.
Okay, we don't have any formal fee as prescribed in our regulation or by the Pharmaceutical Society of Kenya. So what we had, the last formal fee, dispensing fee of 20 shillings for item that you dispense, but there has never been a formal fee for a consultation you give. So what I do is I charge between 500 and 2,000 shillings, depending on the length of the consultation. And in a vaccination's ideal setting, I would charge about 1,000 shillings to administer vaccine. Kenya shilling is 112 to the US dollar today.
Thank you, Nail. This was important. And also, I had seen in the chat a reflection about the use of the word drug and medicine. And I completely share what, I can't remember his name, said. Can't remember his name. Yes, Mheted Ksheba. Because we have the same purpose in France, exactly the same. Drug means for us controlled drug, means medicine. But it is so that in US it's always drugs which are used, the name drugs, the word drugs, and not always the medicines. So I just to tell Mhehed that he's not alone to think that. Okay, thank you. We would like to thank all the speakers. We are coming to the roughly the end of this session. But Prosper would like to add some words on the situation of Cameroon.
Okay, thank you, Jacqueline. The situation of Cameroon is not far from the other situation, the ambiguity of the law, the health law in our country, which did not forbid pharmacists to vaccinate, but it is not written anywhere that pharmacy can vaccinate. But the number of pharmacists in our country is increasing every year, of 250 more pharmacists registered every year, which means that we are now 2,400. In 5 years, there will be 1,000 more pharmacists. The number is going up. The barrier that the pharmacy vaccination evolution are facing in our countries, the negative publicity on vaccines. You know, 1 month ago, the government wanted to vaccine the vaccine on polio. The parents took their their children, saying that they have heard that the vaccine is contributing to the infertility of young female. With that kind of publicity, how can you vaccine? But you have also the problem of the policymakers. Policymakers have not put pharmacies in their policy for public health. This is something that has to be changed. The lack of funding, and you are asking fee to our colleague of Kenya. Vaccination is a service, and if it is a service, it has to be paid. But it will not be comprehensible for people to pay for the vaccination. This is something on which we have to talk, to educate people. I'm saying that the lack of funding, the training courses on vaccination are not in schools, in our education, in our universities. This, we have talked about this. The challenges now, the vaccination training is something that we have to think about. Working with regulator for more advocacy also. Select some vaccines that can be authorized for pharmacies. Decision makers should accept vaccination in pharmacy. Now also you should think about the availability of vaccines and good quality vaccines in the country. Pharmacists should become pharmacist educator. That is what I wanted to say briefly in few words before the end of our session. That there are many things to do, but we are going to talk about them in the common conclusion that we'll have in a few minutes. Thank you.
So thank you, Prosper. You really pointed out that how politics are important for vaccination. And I would like to add on this that FIP has drafted a letter that he will send to the member organization. Maybe some of you have already received it. It's a letter that you can address to the Ministry of Health of your country. And in this letter advocates for the vaccination by pharmacists, by community pharmacists or hospital pharmacists, or anyhow by pharmacists. So please take this letter, send it to your Ministry of Health. It's a very useful paper, and maybe it can unlock situations because without politics, it's very difficult to make things going forward. We really have to work with the politicians. Okay, so I would like to thank all of you. I turn now to Nilan for at least last questions and maybe some messages that Nilan would like to give. Mm-hmm. Okay, over to you, Nilan.
Thank you, Jacqueline. Thank you, all colleagues. So before we move on to wrapping up today's session, I would like to invite you to participate in a rapid survey we are conducting to get a better overview of what will be the role of community pharmacists in vaccination and testing for COVID-19. In your screen now you see the entire survey on this slide, so it's not going to take much of your time, but it's a paramount and importantly survey. So it will take few of your time to send this valuable information to FIP. You can use your phones right now to scan the QR code you're seeing on the screen, and you can go directly to the survey by scanning it. And now I'm going to type the link into the chat. So you may also use that link to access to the survey. If pharmacists are involved in any way in these two areas of vaccination or COVID-19 testing, we would appreciate if you can share any details of how that will be done, such as requirements for a medical prescription, if and how the test results will be communicated to health authorities, how pharmacies are dealing with supply chain issues, and what is the remuneration model for these services. So we would like to hear for your responses, and thank you in advance for supporting this global research on COVID-19 testing and vaccination. Back to you, Jacqueline.
Okay, Nilan, are there some questions that we could answer?
We have some questions that are left. One question is from our colleague Mohammed Ahmed Suleiman. Are there any arrangements for pharmacists who vaccinate to be reimbursed by the government? So I think this is more or less aligned with our survey. If there are any examples that our colleagues can share about, provide further detail on reimbursement of vaccination by pharmacists, that would be an interesting topic to discuss. And we have received a question that's, I think, more operational question. The letter will be circulated soon. The letter that Jacqueline has mentioned about the Ministry of Health letter about COVID-19 vaccine and testing. And we have received various questions from our colleague Rostan Sagu. Should I go ahead and read all of them, or should we start with the remuneration question?
Who wants to answer?
Yvonne? Maybe Yvonne can...
Yeah, I think I can. In Ghana, what the Pharmaceutical Society of Ghana is doing, we currently, pharmacists' services are not separately remunerated in Ghana by government or insurance. So what Pharmaceutical Society of Ghana is doing is engaging stakeholders so that what pharmacists do, the contributions that are made by pharmacists can be reimbursed. And I suppose that when we get to that point, so in that sense, a similar situation in administering routine vaccines and maybe emergency vaccines would be similar to what applies in Kenya, where there isn't an official service charge, but then the service is paid for by the one receiving that service. But when we get to the point where we have been able to adequately separate prescribing and dispensing services, we are expecting that we should be able to also alongside get the remuneration for pharmacy services. And so at that point, then vaccination services by pharmacists would be reimbursed. But at this time, it is not. Thank you.
Thank you, Yvonne. I think what you have said is it's for all the African countries with the issue of remuneration of services. But the law should be changed. But it's only advocacy which we can use for that, to talk to policymakers, to make them understand that now the community pharmacy has become a place for service, for health services, not only dispensate medicines. It is important to know that, and pharmacy should be trained in that way also. The remuneration will not be the margin on the medicines. The next remuneration will be the remuneration of the services, and this has to be developed.
Do we have a point of view from Redouane?
Sorry.
Redouane? Maybe not.
Yes.
Oh.
Can you hear
Yes?
me? Sorry, because I was disconnected and I'm back. The first part that maybe because I lost the second part, the first part that I heard from Prosper, and I would like also to contribute on that. When we are talking about our contribution, let's say in terms of fees, if today we would like to vaccine, so we would like to get a remuneration. And from Algerian perspective, this is really sensitive topic, because as Social Security is reimbursing 90% of the population. So when we talk about services, the Social Security, I mean the payers, they don't see really the outcome and the service that we are providing as a community pharmacist.
And here, maybe I think we need to go step by step. Maybe the first one is we need to demonstrate the added value as a pharmacist. For example, when we talk about vaccination, that we are contributing efficiently on the increasing the rate of vaccine coverage. And then when we can demonstrate the benefit economically, doing some maybe some papers for the impact, budget impact, when pharmacists are vaccinating or providing other services. And then at this time, we can go maybe and request remuneration as it's reimbursed, for example, for the case of Algeria.
Great, Welwan. Thank you very much. All this is very thoughtful. So, Nilan, should we stop here or?
Well, there is actually an important question that we can perhaps discuss. I know we run out of time, but I think it's worthwhile to mention. We have received a question through Rostan Sagu from Dr. Henry Ainadou from Benin Republic. The question is intended for Prosper, but perhaps the panel can explain as well. So the question is about actually vaccine hesitancy among the public, and also the patient safety issues around vaccines. So I think it's important to mention about the uptake of the vaccines and issues around the patient safety. So perhaps we can take that question and then wrap up quickly. Prosper, would you like to take that?
Yeah, I didn't really understand the question of.
Okay, so the question is about the issues around patient safety issues around vaccines, COVID-19 vaccines. So there are concerns around the side effects of the vaccines. So there is a question under that group, and the second question is, what chance could there be for a COVID-19 vaccine to be accepted by Africans? So this is about the vaccine hesitancy that the public is currently have towards COVID-19. So they have concerns whether to take the vaccine or not. So what could be the role of pharmacists towards responding to these patient safety and vaccine hesitancy issues? So that would be the question. Is that clear now?
Okay, it's clear. I think that the role of the pharmacists would be to educate, to communicate, and to have appropriate communication with confidence to the patients. Without that, we cannot move forward with vaccination. We have to break all the barriers, the cultural and the psychological barrier on the vaccinations. But sometimes the claims of people are understandable, because someone was asking me why the COVID vaccine has been fastly produced but you don't have any vaccine for AIDS, for SIDA. Is it normal? These are questions that people have. The AIDS is there for more than 30 years without vaccine, but we have a vaccine on COVID already after 1 year. This sometimes it can create troubles in the head of the patients, but we are there, pharmacists, to guide the patients. We are there to think about the safety. We are there to promote good practices, to promote good medicines, efficient medicines, and good quality medicines. That is what I can say.
Thank you, Prosper. I think that was the last question in the Q&A box, so we can move on if you'd like, or if there are any comments from our panelists. So, okay, I'll mention about our upcoming next event tomorrow. So tomorrow is going to be the last of the regional events in transforming vaccination. So tomorrow Event 3.6 focuses on the regional needs and drivers for transforming vaccination in the Americas region. This involves discussing the progress made in countries in the Americas with regards to pharmacist vaccination, the quality and universal access to vaccinations. We also discuss barriers and challenges and regional needs for future transformation. FIP's members, stakeholders, and partners across the Americas region will join us for a true regional perspective. The event will be run in Spanish, but there will be live translation into English available. So if you'd like, please don't miss this event. Tomorrow, it's going to be from 4 to 5:30 Amsterdam time, and we are looking forward to have you there. And the next slide is tomorrow is the last regional event. We have the Global Virtual Summit coming around on transforming vaccination. This is the program finale, which is a high-level event in which we will recap the primary outcomes of the 24 digital series on transforming vaccination. Together, we will adopt PIP commitment to action on vaccination in pharmacy, and this will be launched during the summit. Global leaders from health and pharmacy will join this landmark event. And again, please join us, save the date, on 17th of December next week from 2 to 4 p.m. again, Amsterdam time. And thanks to everyone for your support, leadership in the mission to advance pharmacy across Africa and beyond. So I'll hand over to Jacqueline and Prosper to close the event. Thank you very much.
Well, thank you very much, Nilan. I think all this is in a good track, and we are in a very promising outcome, I'm sure. Thank you very much, all of you who have participated to this seminar. Thank you to our speakers for their very thoughtful presentation and great interest. Thank you. And it is, you know, as a vice president, I am also the liaison officer with the African country, and I must say it was really a pleasure to be participating and moderating this seminar with this quality. And it was a pleasure also to co-moderate with Prosper, and I will hand it over to Prosper for the final words. Thank you also for the team which is behind this session. Thank you to Nilan, thank you to Farah, and all the persons you do not see, but who are making this session go so smoothly. Thank you to all, and over to you, Prosper.
Thank you, Jacqueline. Thank you, our liaison officer. Thank you all on behalf of Africa. On behalf of APF, I would like to thank all of you, to thank people who are have an interest for Africa. I know that FIP, you have many people that committed to support Africa for the change, for the transformation of the continent. I would like to say this, or to add that we have to work on the laws in our countries. We have, with the support of Dominic Jordan and FIP, things can change. We need to cooperate within the continent also. We need to collaborate with WHO. But for that, I think that the vision of Jordan, the vision of Dominic, of one FIP will help us to be more interactive, working more closer with WHO. I think with all of this, we can look forward. We can continue sharing our experiences, the good experience of Ghana, of Kenya, and from the north of Africa. We can do more, we can do better. Thank you, thank you. Thank you all. Thank you, Jacqueline. Thank you, Nilan. Thank you to all the speakers, and have a good time. Next time we'll meet, maybe physically.
I hope so.
Yeah.
Thank you very much.
Thank you, everyone.
Thank you, and bye-bye.
Thanks for joining. Bye-bye.